In today's Eye on Health segment, sponsored by Highmark Blue Cross Blue Shield, together with Allegheny Health Network, we take a look at chronic disease that, according to the Centers for Disease Control, affects 1 in 10 adults in the U.S. That is staggering, and it's diabetes.
The AHN Chronic Care Specialty Center is taking a new team-based approach to care for patients with chronic diseases. Mikey Hood has more on how it's helping.
Hi, Carl. How are you doing?
The AHN Chronic Care Specialty Program is changing the way a person with a chronic disease is treated by now using a comprehensive approach so they can take control of the condition and live a healthy and fulfilling life. Type 2 diabetes is one condition that is on the rise.
Diabetes is a chronic condition, and a lot of times it is a silent disease until it is diagnosed years after it has been present.
When someone gets a new diagnosis of diabetes, it means taking a step back and looking at their lifestyle choices.
If they're used to taking elevators, they may need to start taking stairs. If they're used to having dessert every night, they need to reevaluate that. It makes smarter choices in having more vegetables, fiber. Let's start with taking a little examination. As an endocrinologist, I find that my job is to sort of assess the risks of the patient, explain the goals of therapy and complications and consequences of this chronic condition, and sort of formulate a recipe for treatment.
The Chronic Care Specialty Center reaches out to patients weekly to help them along.
Even if they say 2 weeks into the program, I fell off the wagon, I'm not following this, I'm not doing this, we can help them get back on track, because this is a life-changing diagnosis.
For Carl, coping with his new diagnosis of diabetes was tough.
I was kind of in denial about it, and then I got angry.
He was concerned about losing his eyesight.
That's one of the things that happens with diabetes. It bothers your vision, and I was afraid of losing mine.
Retinopathy is a long-term complication of diabetes that affects the eyes if the disease is left unchecked.
Carl, being an avid photographer, he was very concerned about developing that complication. So we had to talk about how improving glycemic control and getting regular checkups will prevent this from happening.
One of the most unique things about the center is that a patient has access to an entire team in one office to help manage their condition, including their specialty physicians such as an endocrinologist like Dr. Rao, nurse navigators to help coordinate services such as test and specialist visits. There are counselors, nutritionists, pharmacists, and even a social worker on site. On the first day, the patient meets the entire team, and that team is with them throughout the journey.
They often call back surprised and happy about the changes in the weight.
Dr. Rao says small changes every day make the biggest impact.
You know, I had the standard American diet. I ate too much bread, I ate too many potatoes, I ate too many fried foods. The biggest thing I had to change was my attitude. I thought diabetes was an uncontrollable thing. The
better the diet is, the patients understand, the less medication they need, the better they will feel. So this is an ongoing one-on-one program between the patient and the dietitian.
We had company over the weekend, and I had vegetable quesadillas instead of roast beef and mashed potatoes. My blood pressure's better, I have more stamina, and I generally feel better.
And Carl's ability to do photography hasn't changed since his diagnosis. He still loves it and says,
photography was one of the few things that I did well, so I just followed it. And I love color, I love interactions with people.
The best advice that Dr. Rao gives her patients is,
it is possible to maintain your identity, maintain your current lifestyle, activity level, etc., at the same time making appropriate choices and changes.
The most important thing he's overcome the center.
Besides doing pretty well, I'm not afraid of the future.
To learn more about chronic condition care at AHN that you heard about today, go to PittsburghTodayLive.com. We have a link posted for you there.
And keep watching for our Eye on PTL. It's every other Wednesday, sponsored by Highmark Blue Cross Blue Shield, together with Allegheny Health Network.